Hey, today I'm going to talk about testosterone, not just the hormone or the molecule testosterone, but how it's delivered or how it's administered to our patients. There's so much misinformation out there, and some people think there's some magical way to administer testosterone. I'm here to tell you that testosterone is testosterone, regardless of how you administer it through the body, whether it's through a gel or a cream or injection or a pellet. Testosterone is testosterone. Well, why would you do the gel? Why would you do the injection? Or why would you do the pellet? Number one, with the cream you might do because you just don't feel like having injections. You basically take a little cream and you rub it on your arm, rub it on your leg, you rub it somewhere, and it absorbs into your skin or transdermally and can elevate the testosterone. Well, what's the negative to that? Negative is the absorption rates are really variable, which means it doesn't always get absorbed through your skin into your bloodstream. Number one. Number two is there's a risk of sort of transferring it to any of your family members. If you have kids or a wife or someone else and you hug them, there's a possibility that testosterone on your skin could transfer over to them. Number three, for me, the biggest reason is you got to do it every single day, 365 times a year. That's a lot and a little bit of a hassle. Number two, injections. Injections are going to give you a much quicker response. They're going to go right into your bloodstream, usually intramuscularly. They're going to go into your bloodstream, make those levels go up kind of high, then they're going to kind of taper off, and then you're going to have to do another injection. What's the negative to that? People just don't like poking themselves with a needle all the time. You got to do that. If you're going to do it once a week, which most people recommend, that's 52 times a year. Again, people that don't like injections or are going to be having a habit of doing that for 52 times a year, it's a lot to do. Number three is the pellets. We call those bioidentical pellets. They get inserted underneath your skin, okay? And they get released over somewhere between a 3 to 6 month period. Benefit to that is the pellets go in, you kind of set it and forget it. It goes in, the levels kind of ramp up, then they stay nice and level over 3 to 6 months, and then they go down. You don't have to do anything else. Typically, our men do that maybe 2 or 3 times a year. Again, that's a positive, 2 or 3 times a year, as opposed to 52 or 365 times. The negative to the pellets would be, and I hear this all the time, you don't know how much to put in. That is somewhat true. You really don't know. We have an algorithm. We're usually pretty close. If not, we will get it close on the next insertion of pellets. The other negative is it's a slight surgical procedure. It doesn't hurt, but it's a little procedure that there's a little slit in your gluteal region and it heals, but that's one of the negatives. There's a risk of always infection and bleeding and so forth. Whether you decide to get creams, gels, injections, or pellets is entirely up to you. It depends on a lot of factors. At Innovative Health and Wellness, we're here to help you make the best decision possible so that that testosterone will be administered properly to get you to the levels to make you feel much better. I'm Dr. O at ATL. I'm Dr. O with Innovative Health and Wellness. Check out our website, check out our testimonials and our 5-star reviews, and we'll see you next time.